Okay, now in this we can see the distribution of deep branch of the ulnar nerve. Okay, the superficial branch supplies to the palmaris brevis, which is subcutaneous muscle present. So that superficial branch gives to that palmaris brevis and also gives three digital branches, same as dorsal cutaneous branch. So 1.5 medial 1.5 finger is supplied by this ulnar nerve. Okay, so now this deep branch, okay, the deep branch accompanies with the deep branch of the ulnar artery. So we have seen that ulnar artery, how this ulnar artery passes in the palm. Same way it accompanies with the ulnar artery here. So this is the transverse section. This is the section of the hand, transverse section of the palm. Here you can see this metacarpals 1, 2, 3, 4 and 5th metacarpals. So above the first metacarpal you are having this thenar muscles, and here you will have the hypothenar muscles. Okay, and these are the tendons of the flexor digitorum profundus through which lumbricals are getting originating, and in between these metacarpals you will have this palmar interossei and dorsal interossei muscles. So this side is the palmar interossei, and which are present at the dorsally, that becomes the dorsal interossei. Okay, now, and this muscle, hypothenar muscles, these are the three hypothenar muscles. One is the apponens pollicis, abductor pollicis brevis and flexor pollicis brevis, and another muscle is called the adductor pollicis, which is originating from the third metacarpal and the capitate bone. It is having two heads, one is the oblique head and the transverse head. So this head is originating from the third metacarpal here. Okay, so this one is the adductor pollicis. So these are the muscles, and here also you can see this hypothenar muscles. One is the flexor digiti minimi, abductor digiti minimi and apponens digiti minimi. Okay, these are the muscles present in the hand, on the palmar aspect of the hand, as well as the dorsal interossei here. And the deep branch of the ulnar nerve accompanied with the ulnar artery, it passes backwards between the abductor and flexor digiti minimi. It passes backward in the abductor digiti minimi and the flexor digiti minimi. In these two muscles, the nerve runs backwards. Okay, and then between the apponens pollicis, and then after crossing these two muscles and between the apponens digiti minimi. So these are the flexor digiti minimi and this one is abductor digiti minimi. So after crossing these two digiti minimi, this ulnar nerve crosses the apponens digiti minimi and the fifth metacarpal bone lying on the hook of the hamate, fifth metacarpal bone, and finally it turns laterally. So this one is this side is the lateral side, so it runs laterally within the concavity of the deep palmar arch, within the concavity of the deep palmar arch. Okay, within the deep concavity of the deep palmar arch. This one is the palmar arch and this is the nerve passing here. Okay, and it ends up by supplying adductor pollicis, and it ends up by supplying adductor pollicis muscle. So this is the adductor pollicis muscle here. Okay, so this is the course of a deep branch of ulnar nerve. Again, we will see the deep terminal branch accompanies with the deep branch of ulnar artery. It passes backwards between the flexor digiti minimi and abductor digiti minimi, and then it passes between the opponent's digiti minimi and the fifth metacarpal bone. After that, it turns laterally. Within the concavity of the deep palmar arch, and it ends up into the adductor pollicis muscle. Okay, so this is the course of the deep branch of the ulnar nerve. Okay, so the deep branch give muscular branches at its origin to the hypothenar muscles. So what are the hypothenar muscles? This is the flexor digiti minimi, abductor digiti minimi and opponent's digiti minimi. As the nerve crosses the palm, it supplies the medial two lumbricals. And it supplies 8 interosseous. All palmar interossei and dorsal interossei are supplied by this deep branch of ulnar nerve. And after supplying all these muscles, it finally ends up into adductor pollicis muscle. And it finally ends into adductor pollicis, and also to the deep head of flexor pollicis brevis. So the median nerve is supplied to the superficial head of the flexor pollicis brevis, whereas this deep branch of ulnar nerve supplies the deep head of the flexor pollicis brevis, and it also give an articular branch to the wrist joint. So this is about the supply of the deep branch of ulnar nerve in the palm. Okay, so this is the now supply and course of the deep branch of ulnar nerve. Okay, now we'll see the applied anatomy in the next video.